Dr. Patel, take us through not just the protective gear that's required, not just the expertise and the training required, but take me through the emotional toll that treating patients and treating the volume of patients today and what's expected is taking on our healthcare professionals.
Yeah, thanks. And thanks so much, Nicole, for putting a light on that issue. I mean, I would be lying to you if I told you it didn't affect me personally, because it's just what I see personally and in my colleagues is it's the same thing over and over. It's this feeling of helplessness, not just for yourself. I mean, I actually think most healthcare workers have kind of gotten over it, but it's this feeling of helplessness when you also have to admit patients and they can't have any visitors. And especially when one out of every 3 or 4 have to go into an intensive care unit, that they might die and they'll have nobody there to hold their hand or say goodbye to them. And that does weigh on you. And then volume, you mentioned volume. So the volume, the sheer number of people that we're seeing and admitting, and then that are kind of going through the system, so to speak, is unlike anything any of us have ever seen before, on the order of magnitude. Some places, some emergency rooms are having up to 10 times their normal volume. So it is incredible, constant. And in medical school, we used to joke like we could go 24 hours without going to the bathroom. That's not a joke anymore. People are not eating, they're not sleeping. And then they come home and they're haunted by what they did or didn't do during the day. So, and this is, again, not just doctors. I see it with charge nurses, with janitorial staff who are being asked to kind of clean the rooms as frequently as possible. It's kind of everywhere. Having said that, there's an emotional strength there, and I think Sherry and some of the other folks have been covering it quite nicely. There's a spiritual kind of resilience that this too shall pass, and we shall overcome. But it is almost all of us go to bed and cry every night.
Sherry, your name has been invoked. I've been reading your reporting for a long time, and I don't know that anything has struck me and sort of reduced me to tears as quickly as your reporting from last week about the hospital in Brooklyn. Take me through what you saw and how they're doing this week, as it's obviously getting worse, getting more intense, getting to be more of a grind.
It is, unfortunately, and what Dr. Patel said is right. They are just continuing to work. What's happened last week, I spent time in the emergency room and then sort of followed patients through. They had a tent where they were, and still are, testing people. This week, it has shifted into more of that really very sick patient in the intensive care unit. So as time goes on, as the numbers of people get sick, and then of course you get sick, there's an incubation period, you get sick, and then for those unlucky proportion of people who get critically ill, that's sort of what the hospitals are dealing with now. More and more people of those critically ill. At the same time that is expanding, the staffing, there are people getting sick. Of course, we've heard those stories you mentioned at the top of the hour. So there's a shortage of staffing because of that, and the intensity level of the patients is higher. They are expanding in the hospital, finding places to put people, but you still need to provide that care. So that's where that pressure point is. But they're going to work every day. They're being creative. But this is not, when I was there, it was not a hospital as usual. It was very much like hospitals I've been in during a hurricane. Unfortunately, this is a much more extended period of stress for our nation's hospitals.
You know, Dr. Patel, can you speak to that about the duration? This is not, as Sherry said, this is not something that's going to hit us and then we begin our recovery. This is something that's going to hit us harder and harder and harder and harder and harder until we reach a peak, which in New York, experts are saying is still weeks away. Can you talk about what's being done? I mean, it's not just, as you've both talked about, the physical toll, not being able to go to the bathroom. And I've read reporting that it's the shortage of personal protective gear that means they don't stop and have a meal. They don't take a break because they don't want to take that off and perhaps contaminate something else and then use up more equipment. But this is going to be our new normal for a long time.
Right. And Nicole, honestly, it's the inability to kind of have that date certain. I mean, it would be one thing if we knew all right, snap our fingers and June 1st, things will go back to normal. But the whole reason that everybody is working, literally 24/7 in some cases is because we have to get through this surge. But then even when there's a quote decline or, kind of a lessening of the numbers of cases, it's still about having the people that you have in the hospital and trying to make sure that they go through the recovery period. And by the way, there are 78,000 volunteers coming into the state of New York ready to help. But they all these people have to learn how to work in teams. And so it's not just knowing how to do this with the personal equipment. It's also dealing with the uncertainty. And so you're absolutely right.
Can you talk about the models? I mean, it's sort of a grim way to process what we're all living through, but it is the models on the death toll of our fellow Americans that are expected to die under the best social distancing practices. And Dr. Birx said yesterday that if we are perfect, 200,000 people will die. What does that, how do we begin to contemplate what that looks like for our healthcare professionals? How many people will get sick for 200,000 people to die?
Yeah, it's for 200,000 people. Yeah, absolutely. So for 200,000 people to die, we know that we have to have millions who at least have the virus, and then of that, a percentage that will get sick. And we know already that if 1 out of every 3 hospitalized people ends up in the ICU, all those things just increase your chance of death. And candidly, Nicole, that's why we're seeing a lot of people coming into the clinics and the emergency rooms who really don't need to be there. But that, unfortunately, is adding to the numbers that are kind of coming through the system. So 200,000 to die means that if you're going backwards, that's millions of Americans affected by this in some way. And keep also in mind, we have not done the type of testing. You've already heard the governor of Montana talk about how they were running out of tests in a day. So we have not, in certain hotspots like New Orleans and like other areas, I've been tracking cities and testing. We have not done anywhere near enough testing to be certain about these numbers. So all these models, the data is only as good as the data coming in. Every day it's better, but in certain places like Boston, we might be seeing some progress. And then in certain cities like New Orleans, we're seeing numbers that are very troubling.
Sherry, your reporting and the reporting of your colleagues in the New York Times tells the story of the plight of the healthcare workers in such vivid terms. I wonder if you've been able to uncover through your reporting where the disconnect is, why there could possibly still be a debate among political leaders, and namely between the White House and some governors. They seem to be mostly Democratic governors and people who are leading states where some of the hotspots are now, about what's needed, about the numbers of ventilators, about the amounts of protective gear. There was an insinuation that doctors and nurses were doing something worse than hoarding. I mean, if and I'm not saying it's easy to tell their stories, but if doctors and nurses are willing to talk about what it is they need, where do you think the breakdown is for them to get it?
I mean, it's hard, right? So you've got one thing is the projections, the modeling. Of course, every expert who is participating in those modeling exercises says that it's a model, it's an assumption, it's hard to know exactly. But certainly we don't want to be not prepared for some of the more worst case scenarios. And of course, as people change their behaviors, as we have the social distancing, the numbers will decrease. And there's a time lag too. So you will still see the numbers going up for a while before those, measures show themselves at the hospitals, because again, that time lag between infection and getting sick and then getting critically ill. So that's one thing, is there is uncertainty. There are a range of models. That's one basket of things. And the other, the differences between I have to be honest, I'm reporting so much that I'm not watching all the press conferences. I know that there are some conflicts between
You're not missing anything.
what the states want and what the feds, and then, there's that extra factor, even when it leads leaves the federal stockpile, think about this, gets to a state, then gets down to a local level, then gets to a hospital level, and then gets out to all the units and the patients. There's a time lag there. So you may literally have things going out, entering a supply chain, and then not feeling it necessarily at the end of the supply chain, or there can be disruptions along the way. So all of that is in the mix, and I'm sure there are a lot of factors, and it's hard to have surety at this time. But certainly we don't want, it's very clear. I think everybody can agree that it is preparedness now and supplying these hospitals and the staff, the brave staff going to work every day. It's absolutely critical. Yeah. And I'm seeing it with my own eyes. They don't have enough. They are conserving, and that is a risk to them. So yes, there's probably truth in many aspects of it.
Sherry, I want to ask you about Dr. D'Souza, who comes to life through your reporting last week. I want to know how she's doing this week, but because I think you were with her last Monday, but I want to read you some of what you wrote about her last week. She said, "I have so many different fears." On Wednesday, if the patient volume increases at the current pace, she's concerned the emergency room will be out of space by next week. That would be this week. If many patients are desperately ill and need life support, she worries about having to choose between them. Her fears have come true already. Any update on how she's doing?
Well, and I should just say that ventilator triage rationing essentially is something that many places are talking about. We've certainly seen that happening in Italy, those horrible stories of not having enough ventilators, not having enough critical care space, and actually implementing rationing. To my knowledge, it's still very much in the planning or preparing stage here. There are maybe some decisions being made about conserving those resources, but they haven't, at least as far as I know, the triggers being pulled haven't exactly happened yet on an official level. And, the emergency room is busier this week. Absolutely. And Dr. D'Souza's colleagues are trying to force her to take a little bit of a break every once in a while. These people are just... Yeah, it's so tough, and they're so dedicated, but they do have to pace themselves because this is a marathon. It really is.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.